So my focus of presentation will be landmarks in the health research ethics, ethical issues in the research pertaining to human research in adult and children both. Then there is a term which is introduced recently, 2-3 years back, called academic research. And then there are issues of clinical research on drugs and devices. Then post-trial access is also part of that, and ethical issues in writing a case report, because case report will be a very preferred way of making publications, particularly for clinical departments. Then for composition of ethics committees, their duties and composition, stem cell research, maybe some departments are involved in doing stem cell research. Then animal research, largely pharmacology and physiology departments are involved. And then a word about publication ethics. Now, I will start with landmarks in the development of ethical principles in human research. The first one is called as Nuremberg Code, which was made in 1947 after World War II. I think World War II brought a lot of problems to human beings. Also, the problems to the research participants, which I will elaborate. Then Declaration of Helsinki in 1964. Then there is something called as Belmont Report, 1979. Good Clinical Practices and International Conference on Harmonization Guidelines, 1991, and then it keeps on getting updated. ICMR also made its first ethical guidelines in 2000, got revised in 2006, and then again in 2017. Then ICMR made modifications very specific to COVID-19 pandemic in 2020. Otherwise, it was not possible to approve research. Now, I think before I go to that, I'll put this picture to you. Somewhere in 18th century, Edward Jenner observed that the milkmaids who were milking the cows, who were affected by cowpox, these women did not get smallpox. Smallpox was a havoc at that time, you know, it ultimately got eliminated, fortunately, from the world. So he thought, why not give healthy people cowpox material so that they also get protected like all those milkmaids who were collecting the milk. So I think he started his experiment on his own son and all neighboring children, and then caught hold of them, and then started giving them cowpox material, injecting in a very crude way. You can see this being injected. All parents are so disturbed. They are also crying like a child. And the end result was wonderful. The cowpox worked very well, and in that community where he tried, the smallpox gradually became less. But question comes, is it ethically right or wrong? I'm sure all of you will agree, in the current context, this cannot be called as ethical research. But what he did was a daring effort, but that time no ethical guidelines existed. So this was the first research which was unethical but gave wonderful results. Then, as I showed, I think many of you might have seen this slide of mine. In World War II, the Germans caught hold of Jews who were their prisoners. They started doing experiments on them, and then they did every experiment to see whether a person survives or dies. You can remove the blood to the extent that he dies, or you can put him in the cold water bath till he dies. And then they used different volumes of blood. They used different temperatures of water to see what is the final outcome of the experiments that they were doing. They came to a very firm conclusion that blood loss more than 1 liter will cause death. Wonderful research. You will agree with that. But what was the end result? You killed the person in an effort to get this result. So is this research justified? Answer is no. Then putting a person into cold water bath and seeing at what temperature will he die. Again, wonderful research. It gave you an idea that if a person falls in cold water in a stream, how long will he survive and whether he will survive or not. Both these researches were very unethical. By that time, there were some guiding principles about research, but Germans did it on Jews because they were the prisoners and they did whatever they wanted to do with them. So a court was set in the town of Nuremberg, and this was consisted of judges from US and Europe. And then all Nazis were tried for their war crimes. But important to know is 23 physicians were also tried because they did unethical research. 16 of them were convicted. 7 physicians were sentenced to death. 5 were imprisoned for life because they did an unethical research. But what was evolved was important. The concept of consent and do no harm. You cannot do a research till person has willingly consented for the research, and you should ensure that when you are doing research, whatever benefit it may give to mankind, it should not do harm to the human being which is involved in the study. Then came the Declaration of Helsinki, which was adopted at 18th World Medical Assembly, the central body, which updates its guidelines periodically. It says that before you do a research, you should make a protocol. It should be reviewed by an independent ethics committee. So now when you make a synopsis also, it will go to institutional ethics subcommittee where some of us will be members. It will be reviewed that what you are planning to do is the right thing or not. And if it is right thing ethically, then only it will go ahead. Besides a scientific evaluation of the project. Then you have to make an informed consent, which is recommended by Declaration of Helsinki. The research should be qualified by, conducted by a qualified person. If you are doing an Ayurvedic research, you have to have an Ayurvedic doctor in your research team. If you are doing an allopathic research, you need to have a pharmacist, a physician in your team. So only a qualified person can conduct a research, not everybody. A pharma person, a pharmacist, or a pharma employee cannot conduct a research. A physician can conduct a research, a surgeon can conduct a research. When you are assessing about the study, this guideline says that you have to evaluate the risk to the participant. Only when the risk is less as compared to the benefit, the research should be permitted. That was Declaration of Helsinki, and you should remember this. This could be one of the questions that you may have in your research methodology course that you will be doing. Then I also gave last time an example of Tuskegee syphilis study. This was conducted between 1932 onwards till late 40s and 50s. This was in the state of Alabama in United States by United States Public Health Services Department. It is like Public Health Service Department of government in India. So what they did is they involved a lot of poor American farmers in the research. They were all black because blacks were hated community that time in America. They were considered second-grade citizens. So they were taken into the study. They were trying to see how syphilis will progress, what will be the outcome of syphilis in these people when followed further, and whether they will die or they will recover in the natural course. Then, but in the process, a big remark happened. Somewhere 1943, penicillin became available for therapeutic use and it used to work wonders in syphilis. But they kept this information hidden to the participants. So this was willful suppression of information about the benefit that they could have derived from penicillin. The end result of the study was 100 disabilities, 28 deaths, and 19 cases of congenital syphilis. So what is your opinion? You will all agree that this was a bad research. Therapeutic options were available, they were not given to them. You will also agree that because they were black and at that time of period of time, they were considered second-grade citizens with no voting rights, that they were involved in the research and so on. They found multiple faults with the study. Once the matter started coming into the print media and criticism went into the radio discussions. Then they made a committee which often used to meet in a place called Belmont, and and then they ultimately came to a conclusion and made what is called as Belmont report. The Belmont report was submitted in 1978. So, see, study started in 1932. Penicillin invented in 1942-43. But these Americans who were researchers, and that too from government department, continued to do the research till the media picked up. And that time, media only used to be largely newspapers and radios. So there was no TV that time. And this discussion went on for 2 decades. Ultimately, a government of America agreed that our own organization, that is USPHS, did a wrong research and suppressed the facts to the participants by not providing them penicillin, and continued the research because they had grants to do the research. And ultimately, President of America at that time, Bill Clinton, told that I am sorry to our African American citizens that your federal government orchestrated a study which was so racist. A $7 billion compensation was paid to the survivors. There were few survivors. Most of them were rather the relatives of the survivors, so they were given that money. So this is one example how research was unethically conducted even in the modern era, which ended up with a disaster, but led to the greatest principles in the medical ethics in the research, and that is called as Belmont report. So what are the principles of this Belmont report? It has 3 major components: respect for autonomy. Participants should make informed but voluntary consent. So give him information. If he decides to participate, he is welcome. If he somewhere halfway also he says, no, I am not interested, this particular observation, treatment is giving me a lot of trouble, I am not interested, he is free to walk out of the study anytime. Then second was beneficence. Researchers should target an action in such a way that you should try to minimize harm to the participant when you are doing the study. And justice. There should be fair distribution of burden and benefit in the research. I'll give one example. Supposing you are trying a drug which lowers cholesterol. Now, halfway through the study, you find this drug works wonderfully. It lowers the cholesterol and can reduce the cardiac risk. Other arm had a placebo or an older medication. Now you realize that this particular group which is receiving the cholesterol lowering drug which works effectively will prevent a lot of deaths because of heart disease. So you have to stop the study there. Give that drug to both the groups. So that is the principle of justice, that you should do a fair distribution of burdens and benefit of research to both the sides. This is called as premature termination of study to give benefit if it is noted in one arm of the study. Now then, lot of drug trials started coming worldwide, so there was a need to make more thorough guidelines, and this is called as International Conference of Harmonization and Good Clinical Practice guidelines. So study research only when it gives benefit more than harm. Then exclude vulnerable subject, which I will define. Right and safety of individual patients should dominate in research over benefit to community. People do research saying that maybe 1 or 2 individuals are harmed, but community at a large is very much benefited. No. First, protect the right of the individual who is participating in the study. Then comes the right of community. So first, protect the individual who is participating in this study. The research should be conducted only after clearance by independent ethics committee. This is extremely crucial. You cannot start the study and after 6 months you try to get an independent ethics committee approval. You need to take the ethics committee approval, which will be happening first, and then there will be approval. Then the study will start. Then you have to give informed consent from the patient who should understand why this study is done, what are the harms, what are the benefits, and whether he will have any advantage if he is affected by the drug which is given to them or the device which is used on them. And in the end, you have to preserve the record of your clinical studies or drug trials for 5 years. This is ICH-GCP guidelines. And then I told you should know who are the vulnerable groups. Mentally ill, old age, uneducated people, your own employees, your own students, defense forces, institutionalized patients, pregnant females, children, prisoners, and tribal population. Obviously, if you are a psychiatry resident, you have to do your studies on mentally ill. So that is where there is an exception. Obviously, if you are a pediatric resident and you are doing some study on children, that category is excluded. But see, what happens is, some of our colleagues say that we have such a huge manpower in form of medical student, UGs and PGs. So I'll do research on them, and we'll get quick results in the students who are easily available to them. The answer is no, you cannot take your own students in the study. So own student, as a professor of medicine, if I do study on a student of anatomy, maybe it is yes. But if I do student study on a third MBBS part 2 or part 1, or a first year student who will become my student later, I am not justified in doing study on them, because the students are afraid and may consent because I may affect their results or their career and so on. So this is important. So pregnant females normally not suitable for any clinical studies, drug trials. And tribal population, for various consideration, ICMR says avoid doing this. Prisoners and defense personnel, because they have limited rights and they are supposed to follow what the instruction says in their setup. So best avoid research on these populations. Children, you have to do research, you have to do vaccine research, start from children only. The drugs which are used in children are also to be tried on children only. So parents have to take a decision if the child is young. If the child is older, say about 12 years, 13 years, 14 years, 15 years, the opinion of child also matters, though he is not major for giving his signature, but we call this as assent. If he says, yes, I am willing, then it is assent. Though father will sign, mother will sign, but child should also agree. And child, after convincing also, he says, I am not interested. Even if my father says, please do not include him in the study. So child's assent in an older child is important. See, in the Indian perspective also, lot of things happened. There are stories after stories where we also erred like Americans or Germans in World War II. Somewhere between 17 and 80s, there is an institute called Institute of Cytology and Preventive Oncology in New Delhi. They started seeing the results of pap smear observations, whether people showing abnormal cells will develop cervical cancer or not. They kept on doing observations, though they found certain smears as abnormal. They should have discontinued this study, but they did not. So after the controversy and newspaper reports, this study was stopped. ICMR made its first own indigenous ethical guidelines called as Ethics Guidelines for Biomedical Research on Human Subject in 2000. Then updated in 2006, and later, now the last edition is 2017. These are the links which I'll share with Dr. Jadhav. Anybody interested, you can directly download these guidelines if you are more interested in knowing about the ethical principles. These are the booklets that I am mentioning. This is for adults. This is a summary version of same book. This is ethical guideline for biomedical research involving children, and these are the guidelines for stem cell research. Incidentally, for your information, we have a stem cell committee here. We do a lot of stem cells research. The center is situated in the dental college. Certain basic sciences or paraclinical branches residents, if interested, can get stem cell research committee approval and can also be involved in the stem cell research. So clinical branches usually are not interested. Then another landmark, which is not very old, 10 years old, there an NGO called as Swasthya Adhikar Manch in Madhya Pradesh. She filed a public interest litigation in Supreme Court saying that there are a lot of deaths in India. The Indians are being used as guinea pigs by international companies to conduct research which they are not able to conduct in their own country, and government of India should be answerable to this. So Supreme Court asked government of India to put an affidavit and put all the facts together, whether there were deaths and whether the compensation was given or not. So government of India gave an affidavit, said that during the period for which they have asked, the PIL has been done, there were 2,644 deaths in the trial participant, but only 80 deaths were related to the trial and 40 of them were given adequate compensation. Why so many people died? Because they were trials on heart disease patients, heart failure patients, cancer patients, trauma patients. They were anyway likely to die and they died of their own disease and not because of drugs. The fact remains that during the trial period, 2,644 people died, but directly as a consequence of the trial medication, only 80 people died and 40 of them were adequately compensated. So government of India told that there are a lot of, the Supreme Court told that there are a lot of lacunae in your guidelines, so make fresh guidelines. So when ethics committee guidelines were revised again, so now what is ethics committees? What comes under the purview of ethics committees? All human health research comes under the purview of ethics committees. So remember that all the synopsis that will be submitting will involve approval of scientific and ethics committee. For convenience of PG students, we have made an institutional ethics subcommittee which quickly goes into the project submitted, a synopsis submitted by PG students for a quick decision on approvals. So what is the composition of ethics committee? Ethics committee should consist of what ethics committee is supposed to review: all medical records, all biological sample studies, epidemiological, social and psychological studies, drug and pharma studies, medical device studies, medical radiation studies, surgical procedure studies, and stem cell for therapeutic use studies. So the composition is chairman, who is an outside person. Our ethics subcommittee chairman, to whom your work will go, is also an outside member, is a scientist in NIV. And our ethics main committee is a retired dean of this college, but he is not associated with this college now anymore. Then few basic medical scientists, some clinicians, legal expert, one social scientist, one lay person, and one member secretary coordinates. For you, Dr. Gandham is the member secretary to whom you will be submitting your projects for ethics evaluation. And at least there should be 7 members in the committee, and at least there should be 5 members present to approve your project. And it is essential that a lay person should be present in the committee even if there are 5 members, and a law member should also be present even if there are 5 members present. Law, because he takes care of the legal angles, and lay person, because how a common man feels about research is more important than what a scientist feels about. So there are 3 types of reviews: exempted from review. No research is normally exempted from review. Expedited review, as we do normally in your studies, we quickly give decision, and a full review. Exempted from review are certain educational studies. Supposing you are comparing the outcome of learning by using chalk and blackboard versus outcome of learning while using LCD projector or overhead projector. Obviously, we know when you teach with visuals, the outcome of learning is better as compared to using chalk and blackboard, which does not give a very good visual impression. So that is the only one which is exempted from the view. Now, later people thought that the consent is not taken properly. See, now what will happen is, now you sometimes we see, or we all know, that when you are planning a research, you quickly ask patient to sign. Baba, इस पे sign कर दो. He says, मेरे को मराठी पढ़ने नहीं आता, sign कर दो, नहीं तो अंगूठा लगा. So this is how we quickly take the consent. So this was pointed out at national level, that consent is taken forcefully or without understanding by the participants. So government told that we want to understand how the consent is taken. So audio visual concept of consent was taken, but later government realized that it is a disaster. You cannot keep on recording every consent in audio visual form. So now only new drug trials in HIV and leprosy and any new molecule or entities being tried for the first time, you need to have audio visual form of consent. Other places, no. Now you should know there is something called as a compensation. If you are involved in the drug study as a part of your research, which we discourage, the DPU discourages and rather says no to drug trials being part of your research project, except for pharmacology and for anesthesia department. Because anesthesia is all anesthetic agents and nothing else. Or pharmacology, because they are all drugs. In case of death, their dependents are to be given compensation. Hence, in all drug trials, the pharma industry gives an insurance coverage to the research participants. So, what the ethics committees have major roles. They have to see whether there is a benefit risk ratio, whether justice is being given, whether there is a community involvement in the research, whether you give post-trial access to the participants. See, what happens is, now if you do a research and you find a particular drug is very useful and you complete the study, now question asked is whether I'll get this drug in future or not. Usually once you say the drug is good, it requires almost 6 months to 8 months before this drug could be marketed. So it is the responsibility of the pharma industry to provide that drug free of cost to the person till he is able to purchase from the market. So that is called as post-trial access. Now, I'll explain the concept of academic clinical research. An academic clinical trial means a clinical drug that is already approved by certain use, and now investigator wants to try in another setting. He can try, provided he is trying only in an academic institute for academic purposes and not for commercial use. I'll give example of anesthesia department. You have two anesthetic agents. Both of these are approved, which you are using it so routinely. Now, you want a particular agent is used for abdominal surgeries, another agent is used more for thoracic surgeries. Now you want to see whether the agent which is used for abdominal surgery can also be tried for thoracic surgeries, which last longer than abdominal surgeries. So you can make an experiment, but this will be only for academic purposes under a supervision of a senior. And then whatever conclusion you draw, it cannot be marketed because you drew a particular conclusion that it is good even for thoracic surgery. So this is called as an academic trial. So anesthesia department, in my observation, is a past chairman of institutional ethics committee, that 80% of the studies are based upon pharmacological agents in form of anesthetic agent being tried in various combinations and doses and routes. That is academic. Now, in drug trials, the general principles are same. You have to ensure that there is a voluntary disclosure to the patient. There is willingness on the part of patient, and the person who is conducting the research is competent enough to conduct the study. See, now the ethics guideline 2006 and 17 told that ethics committees should meet physically in a room and discuss rather than taking a decision on emails or on phones. That was fine. We used to meet. We used to sit in a council hall of college or some lecture hall and uh, and meet and decide whether to permit or not to permit. But then came the COVID, where the physical meetings were not possible. As of today, now I am also teaching first time online. Otherwise, we conducted these lectures physically in one of the lecture halls. So ethics committees also, they told that ethics committees can meet online and take a decision first by a group of 3 to 4 people connected with that research, and then full quorum committee, but online, because there was a time when nobody was allowed to even come out of the house for attending their duties. So these guidelines were modified in April 2020 because of COVID. So this is called as the National Guidelines for Ethics Committees Reviewing Biomedical Health Research during COVID-19 pandemic. Now, all the research that you do, whether it is pharmacological agent or comparison of anesthetic agents or effect of treadmill on ECG in case of anemia, all these are considered as clinical research. So you have to register your all studies on clinical research to an organization called CTRI, Clinical Trial Registry of India, which is under the Institute of Epidemiology and Medical Statistics in Chennai. So I'll see if this link works. This is the, can you see the link? You have to register here, and then you have to register prospectively and then start your study. This is very important. Now, stem cell work. Stem cell, usually in medical college, very few departments would do. Maybe some pharmacology people or pathology people may be interested. So any stem cell study should be done in the perspective of an academic research. Once you find there is a therapeutic potential in your study, you have to register this as a new study rather than giving conclusions that my stem cell work has been wonderful and that can be put to the clinical use. So we have a stem cell committee also where you will need to take an approval. Now, case reports. See, all clinical departments are supposed to make case reports. You find a lot of interesting cases. Your bosses will tell you, record this, we will report it someday. So it is good idea. Case papers are easy to publish, and they carry the value as like any other publication if it is in the good journal. So whenever you decide to write a case report, take the permission of the patient and written consent for using his information, his photographs, so that journals will ask whether you have taken the consent or not. Do not show any identifiers on the records, like his date of birth or his name in full. You may use initials at the most. Then facial features should be masked. At least you might have seen in the case report the eyes were masked or certain parts of the body are masked, not to be shown the identity of the patient. So whenever you plan to write a case report, seek the consent from the patient for using his information and his photographs. And when you are displaying photographs to a journal, mask his identity, preferably by covering his eyes. Now, pharmacology people, basically pharmacology. and physiology people. I presume there is no PG in physiology this year. Maybe microbiology people, they do some animal studies. We have an animal ethics committee in the college, which gives approval for use of rats, guinea pigs, or rabbits. These are smaller animals. But if you want to try larger animals, and my advice will be not to try studies on larger animals like canine, equine, bovines, ovines, because it requires permission from what is called as Committee for Purpose of Control and Supervision of Experiments on Animals. This is a state level committee which meets infrequently and gives permission. It cannot be decided at college level. So now a final word about publication ethics. No standard journal will accept your articles unless you have an permission from institutional ethics committee for your research. So when you will write synopsis, you will write your thesis letter. Obviously, as a requirement of National Medical Commission, you will send this for publication. No journal will accept your article unless you are sent a copy of ethics committee permission to them. Then question is authorship. Who should be first author, second author, who should be included as author? I remember in one of my earlier institutions, Dean used to say, put my name in all publications, whether he is an orthopedic surgeon and the work pertains to gynecology and so on. But authors, you have to decide who are the rightful authors, who should be the first author. The PG student who has primarily done the research should normally be the first author. There could be variations like surgical techniques where PG has just observed and the senior has done the surgery, then he could be the first author. Then you have to declare conflict of interest, like if you are trying a particular suturing technique in surgery and a particular company has provided you with the suture material, you have to mention that suture material that I have told is used in the study and I have given good results. The material was provided to me free of cost by such and such company like Johnson and Johnson and so on. So conflict of interest is to be declared. Never do simultaneous submission. This is another big issue which we are facing time and again. Your examinations are approaching. Your dean says that I will not sign till your work is been accepted. So you do quickly send to a smaller journal. Then he says, no, you have to send it to Scopus journal. Then you send there. The first journal publishes. The second one also later decides to publish. Then you have a same material publication at two places, which is illegal, unethical, unauthorized. So do not try to do simultaneous submission into journals. Do not try to make multiple parts of your research work what is called as salami sizing. You can make one or two parts of your research, but not multiple. Then we have a system of checking the content of your synopsis and thesis both by a software called as Authenticate. And this checking to see whether you have not copy pasted from another work, and this is called as plagiarism check. And not more than 10% of overlap content is permitted by this software. If it is more than that, then possibly you have to redo your writing work again. Never do a research fraud. You have seen 5 cases multiplied by 10 and you say, now I have seen 50 cases. No, you will be caught someday. So this is about publication. So in the end of my lecture, if you remember 3 core principles of ethics, whether it applies to research or to patient care management, these principles given by a Belmont report are respect for autonomy, do justice to the patient, and do beneficence to the patient. Thank you.